Heartblock, diagnosis and treatment. In the previous video, we had discussed what is heart block, its causes, degrees and symptoms. This video primarily deals with the diagnosis and the treatment option of the same. By definition, heart block is an abnormal heart rhythm due to the failure of the transmission of electrical impulses, which slowly disrupts the normal functioning of the heart. Please do remember, heart block and heart attack are not the same condition, and this video is on heart block and not heart attack. So let's begin with the diagnostic test of this disorder. As explained before, the diagnosis of heart block is completely based on the ECG reading. ECG or electrocardiography helps in assessing the heart's electrical activity and thus determining any problems with the heart's functioning. ECG helps understand not only whether a patient is having a heart block or not, but also helps in determining the type and its degree. A patient may need to wear a Holter monitor in case the patient have to be monitored continuously. This Holter monitor is a device that continuously records ECG of the patient while the patient resumes normal activities. Based on their recordings, a diagnosis can be made. An implantable loop recorder is another device which is placed under the skin of the patient's chest and can monitor patient's heart rhythm for up to 5 years. It is used infrequently in patients who have an episodes of irregular and severe arrhythmias, which typically occurs in patients with heart blocks. Coming to the treatment strategies, usually the first degree heart block are asymptomatic and usually does not cause much of a damage to the patient. The patient does not require any specific treatment for it and mostly requires to monitor themselves for any changes. The second and third degree heart block requires to be treated as they can prove to be fatal. Now if you remember, one of the causes of AV blocks are medications. These medications are usually prescribed to the patients during a previous cardiac conditions, which is why they have the tendency to act onto the heart and cause the heart block. Thus, when it comes to medical management of heart blocks, stopping the medications like Digoxin, beta blockers, calcium channel blockers and antiarrhythmics is the first line of treatment for most of the patients. Sympathomimetic agents or vagolytic agents can also be prescribed in case of a third degree heart block without any ischemic condition of the heart. These drugs decreases the activity of the vagus nerve, which is a nerve supplying the heart. Its main function is to slow the heart. In heart block, the heart's rate is already slow. Reducing the vagal tone will at least reduce the control of the vagus nerve onto the heart. This will further help in increasing the heart rate. Common vagolytics used are atropine and isopretoronal hydrochloride. Catecholamines are another class of drugs widely used to treat heart block. They act on the beta adrenergic receptors to increase the heart rate and contractility, and by acting on the alpha adrenergic receptors to increase the blood pressure. Common catecholamines used are dopamine and norepinephrine. Now these are just conservative treatments. Most of the patients with second or third degree heart block will be treated by the placement of a pacemaker. A pacemaker is a small device fitted in the skin of the chest region. It takes over the function of your SA node, the natural pacemaker of our heart. So the device will now control the heart's beating and will thus ensure that the heart is beating at a pace that is required for survival. And it does so by sending electrical impulses to the heart muscles just like the SA node. Most of the pacemakers sends these impulses only when needed and are thus called the on-demand pacemakers. Then there are those which sends the impulses continuously at a fixed rate called as the fixed rate pacemaker. To fit the device, a surgeon creates a small incision in the chest and inserts the lead through the subclavian vein, which will be attached to the chamber of the heart. These leads are then attached to the pacemaker, which is placed into the pocket under the skin of the chest or the abdomen. This procedure is usually done under local anesthesia and the patient remains awake during the whole procedure. So this is all for diagnosis and treatment of heart block. Please do like and subscribe our channel and stay tuned to Layman's Medicine.